Hi everyone, welcome back to the channel. Today we're exploring a common yet often overlooked oral health concern, gum bleeding or gingival bleeding. Whether you've experienced it yourself or simply want to understand what's happening beneath that blood, stick around as we break down causes, symptoms, diagnosis, and treatment options, all based on expert insights from Dr. Ruaya Mavel. Gum bleeding can stem from several oral health issues, primarily gingivitis, periodontitis, also known as periodontal disease, and less commonly, systemic conditions. But not all bleeding implies a serious condition. Sometimes, it's simply the result of brushing too hard or improper flossing technique. The key? Occasional bleeding due to mechanical irritation is not necessarily alarming. However, if bleeding occurs spontaneously or at the slightest touch, it's a red flag that should never be ignored, regardless of age or severity. There are several potential triggers behind gum bleeding. Incorrect brushing or flossing technique. Vigorous or improper brushing, especially using a hard bristle brush, can injure gums. This is notably more common in adults and women, often due to hormonal influences. While it doesn't always indicate disease, persistent bleeding should prompt a visit to the dentist. Sod-Bame estar gingivitis. This is early-stage gum inflammation, primarily caused by plaque buildup. It makes gums swell, become red, and prone to bleeding, even during brushing or flossing. If it progresses, it may lead to gum recession and unstable teeth. Sod-Bame estar periodontitis. Pyorrhea, a more advanced gum infection, affecting the gums, bone, and periodontal ligament. It's a serious oral health issue, frequently marked by continuous gum bleeding. Sod-Bame estar fitting dentures. Poorly fitting prostheses can irritate gums and cause bleeding, especially if the gum tissue is already compromised. Adjustments or refittings by a dentist often resolve it. Sod-Bame estar hormonal changes. Pregnant individuals may notice increased gum bleeding, especially in the second and third trimesters, due to hormonal fluctuations. Similar effects can happen during puberty, menstruation, and menopause. Sod-Bame estar recent tooth extraction. Exodontia, some bleeding after dental extraction is normal, but excessive or prolonged bleeding warrants immediate dental attention. Other, less frequent causes include nutritional deficiencies, especially vitamin C, scurvy, vitamin K, and niacin, B3. Pericoronitis, especially around erupting wisdom teeth, erupting teeth in infants or children, poorly adjusted orthodontic appliances or deteriorated dental restorations, blood coagulation disorders, or effects from anticoagulant medication. Immunodeficiency, e.g., HIV, cancer treatments, or systemic diseases like leukemia, hemophilia, anemia, diabetes, and vascular conditions. All of these can increase the likelihood of gum bleeding. Common signs that your gums may not be healthy include spontaneous bleeding or bleeding at minimal contact, bleeding during brushing or flossing, finding blood taste in your mouth, especially in the morning, persistent bad breath, pain, redness, swollen gums, dentinal sensitivity, discomfort, or bleeding while chewing. If you notice any of these symptoms, consulting a dentist as soon as possible is essential. Diagnosing the cause of gum bleeding involves a thorough oral examination of teeth and gums, taking a full patient history, covering oral hygiene habits, diet, and medications, blood tests, like complete blood count, coagulation profile, glucose, possibly dental x-rays or panoramic imaging, depending on what's observed. Yes, gum bleeding is typically treatable, but outcomes vary with the underlying cause and how early treatment begins. The most important step is getting an accurate diagnosis and following a tailored treatment plan with your dentist. Treatment focuses on addressing the root cause and often includes improving oral hygiene habits, brushing with proper technique, flossing, and possibly using antiseptic mouthwashes or specific gum care toothpastes, regular dental checkups every 6 months, for cleanings and to monitor or halt disease progression. For advanced gum disease, dentists may prescribe medications or perform specialized procedures as needed. While natural home remedies, like saltwater rinses or diluted hydrogen peroxide, are sometimes mentioned, they should be used cautiously and never replace professional care. Don't let gum bleeding, bad breath, or sensitivity control your life any longer. The real solution is finally here, And it doesn't just mask the problem, it tackles the root cause once and for all. Thousands of people are already transforming their oral health with this breakthrough. Click the link below right now and discover how you can put an end to bleeding gums, eliminate discomfort, and regain total confidence in your smile permanently.